Hey y'all, this is Dr. Tasha and I am back. Let me get positioned nice and comfortable because it's going down in this video. Y'all need to see nothing other than my Christmas tree because I don't need nobody doxing me. Okay, so I'm in the middle of a chemical peel. If you don't know, the girl has some hyperpigmentation. I like to wear makeup because I want to and not because I have to. So I wanted to take care of these areas, and I am in the middle. I'm day 3 of peeling. Day 2, day 3. Anyway, so this is what you see here, but let's just get to it. Cervical cancer. It is near and dear to my heart. And the reason that it is so near and dear to my heart, I guess, as a gynecologist, but it's such a preventable cancer. And so let's kind of get down to the meats and potatoes of what it is and what the deal is in the whole 9 yards of cervical cancer. I felt an urgency to do this because I saw a comment, and I want everybody to be able to speak their truth, to be able to speak their circumstances, and to either kind of vent or be able to feel like they're helping somebody else. But I'm very, very careful about misinformation. I can't get to all the comments. I get to as many as I can, but I'm very careful about, you guys spreading misinformation. I'm like, whoa, 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 whoa. Sometimes I see things that are very wrong. And either you misunderstood the situation, the doctor misexplained the situation, or you just had a bad doctor. But either way, what I read is just not true sometimes. And sometimes I comment, sometimes I don't. So for something as important as cervical cancer, I wanted to get on and do a whole separate video. A reel is not going to do, and I can't do 20 reels about one topic. No, ma'am. So let's kind of get into it. Now, cervical cancer, the things that you need to do to attempt to avoid cervical cancer: 1, don't smoke. 2, do not have unprotected sex. Cervical cancer is the only sexually transmitted cancer. Okay. 3, please get your Gardasil vaccine. I will explain the importance, or what a Gardasil vaccine actually does. And we will move forward from there. And then 4, by all means, I don't subscribe to that every 3 year, every 5 year, over 30, did positive HPV. I don't even know what their recommendations are because I'm not doing it. The reality is that it's an annual exam. You're entitled to exam annually. And at the end of the day, your insurance company will cover it. These doctors are like being super lazy. And then the next thing, I don't care who I offend with this one. It burns my ass when I see primary care doctors doing pap smears. Why are y'all doing that? Like, why are they doing that? I know sometimes y'all are, well, I'm going to just get it done in one fell swoop, just in one place. Well, I'm glad that you feel that your health deserves that level of convenience rather than accuracy. And they say, well, it's just the motion. We can do it right. But when your primary care does your pap smear, once it's abnormal, they can't help you. They can't explain it to you. They can't do anything but send you to me. So bear with me in the fact of your primary care is sending you to me. I don't know you. I don't know anything about you. I don't know your habits. I don't know your lifestyle. They're saying, here, this is her pap smear. Now deal with it. It makes me a little uncomfortable, even though I do it, because it's not your fault it happened this way. Then you're coming to me. You don't know me. You don't know anything about me. You don't know my office staff. You don't know whether I'm a good doctor, bad doctor, crazy doctor. You don't really know. You're terrified. I'm sure your situation hasn't really been explained to you in a way that you're going to understand it. And now, so we're two strangers trying to figure it all out, when they could just say, hey, you need a gynecologist. And you could see me from the very beginning, and we could develop a relationship and rapport of our own. Whatever. Now, so I don't like that. Now, let's talk a little bit about pap smears. Pap smear, the word pap is short for Papana Nicolau. Papana Nicolau is the person who actually developed the pap smear long time ago. And essentially, it screens for HPV and abnormal cells. A pap smear is a screening test. It will never tell you whether you have cancer or not. It is a screening test. Let me be clear. A pap smear is going to check everybody and then say, oh, you're abnormal. You need the actual test. it does not know what your abnormality is. It just knows that it's not perfect. It might say, this is real abnormal, or this is kind of abnormal. Oh, I don't know whether this is inflammation or HPV. I don't know what it is, but I know that the person needs the actual test, okay? So when you come back with an abnormal pap smear, really can't tell you anything. It doesn't. Then you come to me and I'm going to explain the grades of a pap smear. So generally back in the day, it used to take like 18 years to go from no cancer to cancer. Now, honey, with the lifestyles that we have, it takes anywhere from like, I think they said like 6 years, maybe 6 to 7 years. Either way, it is a short time. This is why I don't believe in that 3 year, 5 year. You can go from normal pap to seriously abnormal pap in less than 3 years. So I don't believe in that 3 year, 5 year. Anyway, so you get different grades when it comes to a pap smear. You can get a low grade, you can get an ascus, and I love an ascus pap, to be perfectly honest. If we're going to have an abnormal, I love an ascus, because ascus means atypical squamous cells of undetermined significance, and that is why I love it. Because what it's saying is we don't know if this person has inflammation, we don't know if this person has infection, or we don't know if this person has HPV, which is really causing the abnormality. So potentially this person needs the test, potentially. Now, if you have an ascus pap, the next thing we do with after your ascus pap, we check for HPV. If you have an ascus pap and you do not have HPV, you don't need the actual test, which is called a colposcopy. If you have ascus and you do have HPV, I don't care what kind of HPV it is. If you have high risk HPV, I don't care what the number is, blah, 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 you need the test, okay? So it's very important that you have somebody who's ordering the proper pap smear for you, okay? You need to know what the HPV status is. Now, we have some HPVs, like 16, 18, and 45, we know are so intimately connected with cervical cancer. When somebody has 16, 18, or 45 type HPV, if we come back with that, like let's say I do your pap smear is normal, but you have 16, 18, or 45, you're getting a colpo anyway, or a colposcopy, colpo for short. You're getting it anyway, because those types are so aggressive when it comes to cervical cancer. We just have to get in there and make sure nothing is a brewing, okay? Now, so you do the pap smear, you get an abnormal pap smear, you're generally going to go for a colposcopy. The only abnormality that you will skip a colposcopy is if you have ascus and no HPV. Any other abnormality is assumed HPV or is documented HPV, you're going for colposcopy. Now, what a colposcopy is, and please, I tell people, don't Google this kind of stuff. I have tricks for my colposcopy. Y'all know I don't play with my girls. I make sure everything is comfortable as I possibly can. So you come in and we put a speculum in, and basically it's like a microscope, and we look inside and we say, and we put a couple solutions on the cervix, acetic acid. It sounds scary as hell, but actually it's table vinegar, but it sounds super scary. It's a stronger concentration of table vinegar, but low key, that's what it is. Let me make sure this, I hope the candle ain't melting my damn phone. Anyway, so hold on, y'all. Couldn't find my tripod, so I got my phone propped up on this like huge candle, and I'm like, wait, I hope my phone is not, so I had to blow out the candle. Anyway, so which is a stronger concentration of table vinegar, but nonetheless it's what it is. And so we put that on the cervix, and that will make the cervix turn either like white or super vascular. Either way, if you have an abnormality, it'll kind of like show itself. And so that's when we put that solution on, that we take a look and we say, what did this pap smear find? What prompted this pap smear to say you're irregular, you're abnormal? And then we biopsy. Now, biopsy is the size, it's so itty bitty, it's the size of an ink pen tip. Like, that's how small it is, and you don't have any pain fibers on your cervix. You don't. But your cervix can oftentimes start bleeding from the biopsy, and you'll feel like this gnawing type of cramping, like strong menstrual cramps, but you don't feel pain. For my patients, you definitely don't feel pain. I do something to distract you. You don't feel any pinching. You don't feel any pressure. You feel the cramping. I can't stop that. That's a body reaction. But as far as pain from the colposcopy, None of that, okay? We get a couple of areas. We do a little bit of a scraping on the inside of the cervix, because if you're going to develop a cervical cancer, that's generally where it's going to start. So we do the scraping on the inside, and then we do the little biopsies, and we biopsy any area. It's very subjective. We biopsy any area that we think looks a little bit abnormal with the solution on your cervix. Then after that, we get our biopsies, we're straight, make sure everything's good. Then we put this solution on your cervix called Moncell's. It looks like, if you're old enough to remember, I feel like I'm dating myself, like Sugar Daddy. Remember that Sugar Daddy taffy? It looks like that. And we put it on your cervix. After a couple of days, it'll kind of fall out in the toilet. It just looks like a big clump of weirdness. And that's pretty much it. I tell you not to have sex for a week. After 2 weeks, I usually will bring my patients back and say, hey, this is what we got on biopsy. This is what the plan is. So a biopsy can be a CIN, which is cervical intraepithelial neoplasia, basically CIN 1, 2, or 3. Okay, if you have a CIN 1 or HPV effect, that's like super early, nothing to do. Use a condom, get the Gardasil on board, and we'll talk about Gardasil in a minute. Get the Gardasil on board, which is the vaccination. Strengthen your immune system, sleep, rest, drink water, have vitamins. Make sure you're on your vitamin D. Make sure you're on your vitamin D. Y'all know I don't play about that vitamin D. Once a week, not the D3, D2, 50,000 units once a week. Make sure your doctor gives it to you. So, anywho's, if you have a CIN 2 or greater, so that's 2, 3, microscopic cancer or cancer, okay? If you have a 2 or 3, you're going to go for a LEEP, okay? Now, a LEEP procedure, it's a little bit more detailed. And essentially what we're doing is we go in with like a hot knife. That's not necessarily you're asleep. Or if you do get one in a doctor's office, your cervix is numb, you don't have any pain sensations in the cervix, but you do have sensory, and it's a whole situation. So we go in with the hot knife and we remove the surface layer of those HPV cells that are very, very, very active, and they causing some foolishness. Okay, now a LEEP is very interesting. It varies. What we usually say is when you get a LEEP, if you have a pregnancy or you get pregnant within 3 years of having a LEEP, once you get pregnant, we have to do a surveillance on your cervical length. So let's say your cervical length is this big, generally in life. If you get a LEEP, it's probably going to shrink to that. Right? And as the pregnancy continues to grow, it shrinks. So what we want to know is once the pregnancy gets to like mid-second trimester, like 20 weeks, 21 weeks, something like that, if it's like really shrinking and it's just like, okay, this is really getting short, then you may have to get something called a cerclage, which is like a stitch to kind of help hold the cervix together. You're kind of on bed rest, and our goal is not to put a lot of weight on that cervix, right? Because it is shortening, is weaker, but it doesn't happen to everybody. And if it's outside of the 3-year stretch, then we generally say, we still check the surveillance, but we generally say you don't have much of a risk if it's outside of that 3 years. Does that make sense? Also, if you have a LEEP, sometimes, to be perfectly honest, you can have some scarring on your cervix. So therefore, when you're in labor, it can be a little bit difficult sometimes to get you open, to start to dilate, because you have some scar tissue on your cervix. Oftentimes, once we kind of get it open, boom, it does what it needs to do, but sometimes it doesn't. So those are the things that we have to be cognizant of. But a LEEP is not something we just do very lightly. A LEEP is something that if we do not do it, you will certainly transition into microscopic cancer, subsequently cancer. Okay, so a LEEP is not like, oh, let's just go ahead and do a LEEP, because why not? And I want to be very clear, is that cervical cancer is not treated with hysterectomy. Because some of y'all be like, well, I mean, I'll just get it. No, you won't get a hysterectomy. Cervical cancer is chemo and radiation. And it may still travel into your pelvic sidewalls, into your iliac bones, and all the things, the vagina. So please don't think that, cervical cancer is just blah. No, it can really alter your entire life. And getting chemo and radiation to the vagina, to the back of the vagina, imagine your use subsequently after that. So this is something that you want to take very, very seriously. And I saw somebody in the comments like, I did these herbs and it went away in 4 weeks. I don't know what your situation was. I have no idea, and I'm not gonna surmise or judge and say that that did not happen. I would never do that, but I also don't want you to minimize the disease that can cost somebody their life. Okay, so let's go there. Now, Gardasil. Let's talk about Gardasil, because people are so funny about vaccinations. Baby, do you. Do you, baby. You got to do you. Do I recommend it? Absolutely. Okay. The Gardasil vaccine is you can get it from ages 9 till 45 or 44. Either way, ages 9 till 45, you can get the HPV vaccine. Okay. And it is going to guard against the 9 types of HPV that are intimately connected with cervical cancer. So it's like 16, 18, 31, 33, 35, 45, 52. It's about 9. It's 9 different types. I can't call them all off right this second, even though I did 7 of the 9. But anyway, so it will prevent you. The best time to get it is as young as possible, because if you get it before you're exposed to HPV, you will not get those 9 types of HPV. Now, it's not going to prevent you from getting the other types, but it will keep them under control. Okay, if you do get the other types, there's about 200 types, and we're concerned about those 9 types. But if you do get any of the other types, it will also kind of keep it under control. It won't let it get out of control, because here's how HPV works. Let's say you have unprotected sex, not sex, not just sex. Let me be clear about that. I want you to get your groove on, but unprotected sex. Let's say guy number 1 has type 1 through 10. You have unprotected sex with him, you now have type 1 through 10. Let's say guy number 2 has type 1 through 20. The first guy had 1 through 10. The second guy has 11 through 20. Okay? Now you have unprotected sex with him, you now have 1 through 20. The third guy he was a hoe. He got type 21 to 100. You now have 1 to 100. So HPV has an avalanche effect. Okay? And the more you're exposed to the more different types, the more active it becomes. This is why it's so important to have protected intercourse. So with the HPV vaccine, it's going to only prevent those 9 types, but it also will help control that avalanche effect. You get it? As far as HPV vaccine, the only things we've really seen is people who have egg allergies. You want to ask a question about it, because I'm not sure what the allergic reaction is or how strong the allergic reaction is. That's something to ask the pharmacist. But certainly if you have an egg allergy, we need a little bit of caution. And then back in the day when we were first giving it, like back in the day, like 24 years ago when I kind of first started this thing, I looked at it, do I, y'all? Well, I don't know with this chemical peel, I might. But anyway, when we first started this thing, people were passing out. We're not sure because of the needle, having syncopal episodes. We don't really know, but we would watch people for about 15 minutes after they got the vaccine. And if anything negative happens at any particular time, people hold on to that for like 40 years. Never mind something good happening, something bad happening, y'all be holding on to that stuff. So, but I've never really seen any untoward effects of it, and I recommend it to all of my patients. Get it for your children, especially women. We don't have a test for males with HPV. We don't. So just go ahead and get your son vaccinated. We know his undiagnosed behind gonna be up in somebody's daughter's tutti frutti. So please get your sons vaccinated for HPV. And ladies, please get your daughters vaccinated as well. Like, it can really save a lot of stress, strife, and disease and heartache. So I am all for the HPV vaccine. I'm just letting you know off the rip. So there's that. Now, as far as the LEEP is concerned, like I said, we really reserve LEEPs for people who really, really need them. Now, I am not an aggressive LEEPer. When I do LEEPs, I'm not super aggressive. Why? Because the biopsy is like itty bitty. So I don't need to take this much tissue for a biopsy that's that. Now, I'm going to be aggressive enough, and it depends on you. What does that mean? That means if you are a 29 or 30-year-old female, you haven't had children yet, but you need this LEEP, I'm going to do it and make sure I get a good amount of tissue. But if your cervix is like this, I ain't taking that. But if you are a 45, 46-year-old woman, you're not having no more kids, and that cervix is cervixing, honey, I'm going to try and take as much of it as I can, because it just makes sense. So I kind of try to use the risk-benefit method of that. A lot of doctors may not agree with that. They may not feel that, but it is what it is. If you get an abnormal pap again, we can always do surveillance, but we can't put more cervix back on. And a lot of times, like I said, HPV up until age 31, HPV can clear itself. So I just don't necessarily see the point as being so super aggressive in something that may clear itself, in something that I'm going to follow and have surveillance on anyway. So therefore, if it starts to act a monkey fool, I got my eye on it. So that is generally kind of how I deal with LEEPs and all of those things. But like I said, when it comes to cervical cancer, it's nothing to play with. It really isn't. And for something that's so avoidable, people are so worried about pregnancy when it comes to unprotected sex. They're worried about STDs. Y'all these days, I don't know, y'all different. Y'all a little weird. Y'all don't really be that worried about HIV. I don't know why, but y'all be weird with it sometimes. But nobody ever stops to think about and understand that cancer is very much something that you can acquire from having unprotected sex. So I hope this helps somebody. I hope it blessed somebody, and I hope it kind of gave you a little bit of perspective on how abnormal paps work and what the process is and what our logic is and the HPV vaccine and all the things. And drop any comments below. I try and get to them and read them. I don't comment a lot because I don't do the back and forth thing. I respect your perspective. I respect your feelings. I respect your experiences. So I will comment sometimes, but not a whole lot. Okay. All right, guys. So have a great evening. I'm gonna finish peeling. I'm gonna finish peeling, have a glass of wine, and enjoy my Christmas tree. So happy holidays to everybody.